Hey, everybody, don't adjust your set. I am back. I missed last week. I apologize. I had to do a stint in the joint. I got a D&D. Nah, just kidding. I didn't get a drunken disorderly this year, anyways. Ladies and gentlemen, I am your host, JDUBBS. This is JK'z Watch Bar. With me, as always, except for last week, I wasn't on the show, so I guess I can't say always. Hey, it's just the mood I'm in. We've been out celebrating our anniversary, Jennifer and I. So I'm still feeling pretty good from all the craft beer I was drinking. So depending on how you're looking at, because as we say, no matter where it goes, our editing team screws it all up. And so just when I just say your name, just say hey or wave your hand. So with me as always is Mr. George Muzzy. How you doing, sir?
Good. How are you?
I am doing great. Thank you for a lot of sun. So I might just black out and take a nap, just continue the show. And to the left of him, well, actually to my left is Mr. Eric Evans. How you doing, sir?
I'm doing good. How you doing tonight?
I am doing great. Thank you so much. Last but certainly not least is our guest. We're doing a show on my wife Jennifer. How you doing, Jen?
Pretty good.
So, if you're familiar with our show, we all know what we all do for a living. Jen has been in the healthcare field, I guess I want to say, for just a tad over 30 years, and she's been wanting to tell her story of her health field experience. And if anybody is familiar with the HIPAA laws, there are some things that she just cannot say, and we will not even address the comments if there's any comments. Can't we just can't cross those HIPAA law lines. So, and obviously George and Eric has some questions. So with that, Jen, this is why I'm just going to open up the show to you, and you can start by how you got into the health field.
Okay. Well, when I was a junior in high school, I heard they had BOCES and they had programs up there. So I looked at what ones they had, and it was either between veterinary assistant and then the CNA program. So I was going between those two for a while, but I chose the CNA program because, my mom was a nurse at Willard. My parents were both worked at the ambulance corps in South Seneca, and my brothers were nurses. So I went to the health field and I got my CNA when I was a junior in high school. I also went because my grandfather had a heart attack in 94 and he was in Florida, and I just saw how he was getting taken care of, and I just wanted to just do something for people. So I went and got that. I didn't go on to get my LPN when I was a senior. We just continued doing aide stuff, and I got my first job out of high school at Waterloo. For my boss used to work for my mom at Willard, so it was kind of funny. And Willard, when they closed down, some of the patients went to Waterloo, so my mom knew them. Whenever she'd come in, she'd see them and they'd remember mom, and mom would talk to them, and just what I wanted to do. I saw my mom do it for many years. I knew, holidays and healthcare, and we just did holidays whenever, and that's how I am now. I'm like, it's just a holiday. I can do it the next day, or, so.
How long, if you remember, how long was the CNA training back then?
It was our junior year of high school. So we did extensive. It wasn't now when they do the CNA training in the nursing homes and hospitals, it's only for 2 weeks. But for us, it was extensive. It was the bed making, CPR, the vital signs, just every little thing that I'd try to pass down to the new people that came in, like the little secrets, the little, like, if you don't have soap, shaving cream works for messiness. So, just little things that they're like, oh, really? I go, yeah. I spent a long time in classes. So, yep.
And this is an interesting show because to all of our viewers and listeners, without going into a lot of detail, Eric and George's wives, they are also in the health field. So George or Eric, you have any questions or?
Um, no, not really. I mean, I kind of hear what Jennifer's been saying. You know, it's a life of something that it's a job, but if you don't really like have pride and enjoy what you do and help people and that are in need, you know, it's it takes the right person to do it. You know, it takes the dedication, the care, the love of people that are different, you know, and I think, you know, I give a lot of credit for a lot of people that do that stuff. And as long as they've done it, like Jennifer has over 30 years, that's quite an accomplishment, any job. But to do a job like that, that's outstanding, you know, and still be in it and still enjoy doing it. I'm sure you have good and bad days, but like we all do. But at the end of the day, you go home and you know, it makes you feel probably at days stressful, but days pretty rewarding because you know you helped somebody get to the next day or the next month or year, you know, and actually somebody cares about them. You know, that's what I hear from my wife a lot. That you know, it's stressful work, hard work, but it's rewarding. You know, and the downfall of the business is, as she probably knows, you know, is when somebody passes away. You know, that's the difficult times that I hear my wife talk about. You know, she really gets down and because they become family, you know, they're people that you connect with every day, you know, for many years sometimes. You know, when you lose somebody that's close to you like that, it's kind of a weird work personal relationship you gain with these people. And it's sad, you know. It really she struggles with that at times, but I try to help her get through it and talk about it and just you know, just move on to the next person that comes in the house, you know. It's a strange feeling. She said it's weird because they're you know they're adults or some are younger, older, you know, different challenges, and you just got to do it all over again, you know. And but yeah, that's about what I've got, you know, at this point in the conversation. It just congrats, you know, congrats for 30 years of service. That's great, you know. Um, I don't think there's enough people getting into it and that'll stay in it for 30 years, you know, because a lot of changes have gone on, you know, in the industry. It sounds like some good, some bad, but it's tough. You know, you got to really stay on things, training.
Yeah, it's hard. I mean, I sometimes we're the only ones for them. We're their family, and they say not to get like with my new job with my home health aide. They're like, "Don't share your personal information. Don't." I'm like, I've been taking care of the people for 6 years. I see them more than their family. I'm like, but then I see people that have been in the nursing home and they get burnt out because you have staff, but you might as well not have them because they're not really staff, or you're short staffed, or you're getting hit, spit at, and there's no backup for you. There's just like it, and it gets to you. And I see people leaving the profession that they love because of that, and it sucks. And that's I had issue when I left my job to be a home health aide. I had it. It was just enough, and it stinks because I loved my people I took care of, but
Right.
you have to think about your mental health and your physical health, and
Yeah,
but
exactly.
but yeah, when you get close to people and when they pass, I've taken care of a lot of people after they pass, and it can be it's very hard. My
Right.
friend, my friend and I, Anna, we took care of somebody after they passed. She's like, "Let's go in." So we were crying, we were whatever, but I had to make the mood light. I go, if I lose one of my contacts because I'm crying, I
Right.
go, Betty, I'm not going to forgive you. But it was just, but we wanted to be still take the best care of them even after they were gone. Like, you know, I'd pick out the nicest gown and I'd get them all ready, and just something that I felt that needed to be done. So
Sure.
Yeah.
Yeah, and there's like times that people, when somebody does pass away in a house, you know, setting, the people that were close to that person are affected. So
yeah.
they act different because they get in these routines and, you know, they rely on certain people they live with. And
Mm-hmm.
they're gone, you know, then they have that little void that you as a worker has to figure out, how to manage that. It sounds like, I mean, I don't you know,
Yep.
do that profession, so I just go by what I hear at times, what little bit she can talk about, and just
Mhm.
help her along and keep her going, to keep her mind.
Wow.
You get down on sometimes on the
Mhm.
job. You really do, and you got to have somebody to keep you going, and that's what I try to do with her when I can.
I remember a previous show we were talking about everybody who was in the health field, and I know that Jenn can't say too much, obviously, and I don't want her to. But I think one of the things that all of us agreed was the lack of respect that healthcare workers. To me, I think I mean even a doctor who says who does like say $800,000 operations. I don't think everyone in the health field, including your wives, including Jackie, who does the billing, and everybody who is involved in healthcare. I don't think you guys are appreciated or respected enough. You know, I worked with Jenn as a CNA. That's how we first met. But I always felt like, that we were looked down upon as like below the nurses and all that. And I know that because I've met some people through Jenn, and they just rave about her. So, Jenn, if you want to talk about the lack of appreciation or respect that you have felt over the years, if you can.
I've kind of felt respected. Just sometimes it gets stressful as a worker. I mean, it's a lot less stressful home care because you're one-on-one, you have the time, like when you're in a nursing home setting and there's just two of you to get everybody up and there's 8 bells going off. You have a code blue overhead, you have this person on the floor, like it can get to you and you don't get the help that you need because there just isn't any. And I mean, day after day of dealing with that, you get a little stressful and you try to bring stuff up to the nurses and they try to help you, but sometimes there's just no help and it stinks. Because, I mean, you think healthcare would be, just people just don't want to work now. So that's
Yeah.
the whole thing. I mean, they just don't want to work and
So
it
What-
stinks.
what's the difference between like a direct support person or like a CNA, or what is like the big differences? I mean, I don't honestly know. What?
Between what? Well, CNA is the certified nursing assistant where you just get the people up, bathe them, all that stuff, help the nurses if they need help with stuff that we can help them with.
Okay.
There's personal care techs work on the med floors, like the people that just go to the hospital for procedures or something.
Okay.
So, yeah.
Okay. Because my
But
wife, like a direct support assistant.
Oh,
I don't know. I can't remember the exact state title, but it's like the lower part of the.
But what
care.
Jenn does, she drives to like an individual's house and helps them and stuff like that.
There's a mobile. Okay.
Mhm.
Gotcha. Okay. Not so much in like a house setting where you
No.
get the same people. You just have like a rotation of
Some of the girls that work where I work go into the nursing home. I think they take care of certain people there, mostly like people that are on hospice. I guess I don't go into any nursing home settings, so there's a few of the girls that do that, and I've seen it when I worked in a nursing home. There's aides that go in there and take care of the one patient that's
Right.
on hospice or whatever. So
Wow. Yeah, that's got to be. Yeah.
Yeah. Okay.
Yeah, that's the hard part. Yeah.
mhm.
Yeah, that's.
So Jenn, I know that you have another story, and I know you're probably trying to figure out how to say it without, stepping over that. So one of the things I was thinking of today was, I know that in the nursing home setting, like you said, you might be 1 to 10 or 12 people. So in theory, you don't have a lot of time to do what you do now. And would you, if you had your way, would you, in the nursing home setting, in the hospitals, have enough aides to do all the one-on-ones and that you do now with when you go into a home? would you like to see that somewhere in the future? Like if there's a floor full of 20 people, there's 20 aides to do that, so everybody gets the same.
At least at least 4 or 5, because we were stuck sometimes 3. So at least 4 or 5. I mean, because depending on what shift, because the night shift would get up a certain amount of people if there was a night shift, and it depends on if the nurse helped, but at least 4. Because that made the day a little better, because sometimes you could team off with another aide if you had to get like the 2 assist people up. I mean, that made it easier than ringing the bell and waiting 20 minutes for someone to come out of the room to help you. I mean, if there was at least 4 on the day shift.
Right.
You know, sometimes there were, when I first started there was 5 and there was 4 on evenings, which was holy hell. That was great.
Yeah.
Yeah.
George, you got something?
I don't know. I know it seems like they're always trying to drop the minimum number of employees that work, but it always seems like with my wife and all them, that they're doing a lot of overtime and whatnot, because I mean, you know, you got vacations and you got, you know, people call in, or people, you know, people that work with you get sick or something. And it just seems like sometimes there's a lot of overtime. Sometimes there's not. Like lately she hasn't had quite as much, but then there'll be a streak where she'll put in, you know, 20 to 30 hours of overtime in a 2-week period. So, you know, or more. I mean, and I know that was because of a blizzard, but she's done a couple triples. So
No.
yeah, where she went in to do her shift and she didn't leave for 24 hours.
Right.
But
That's
Yeah.
crazy.
there was a reason for that. I mean, you couldn't leave and no one could get there. So,
Right.
you know,
But that's understandable.
yeah, that one was understandable, but she's done, you know, doubles. And now my daughter, who just turned 29 this year, she started, and I don't think she's hit 2 years yet, but she's over a year, because she was able to, because you have to do your 1 year with the state before you can bid. And she's already bid and gotten another house.
Oh,
So,
nice.
yeah.
Cool.
So she bid out of her house. So she's over a year in. So,
Right. And then,
yeah,
that's exactly what my wife went through. And she gets a lot where, like, if their house is staffed and some other house or 2 or 3 places are not staffed.
Yeah.
And because the state has minimum work staff, so then they pull from another house, and then they got to work.
Yeah. They have, I guess primarily what it is they have a sister house.
Yeah.
Like 2 houses are linked together.
Yeah.
And I don't know if any of you guys know where Dresden is.
Oh yeah.
Yeah.
Living there.
Okay.
2 minutes from our house.
Yeah. Well, you know what their sister house is? Romulus.
Watkins Glen.
Oh,
Yeah. So if you have to go to Dresden, it's within the 30-mile limit, but just barely.
wow.
I mean, technically straight line, it's not all that far away, really.
No.
Yeah, but
there just happens to be a 40-mile long lake in between the two.
So, you know, that leads me into the other thing I thought. Good job, George. You must have read my mind. So, Jen, being a home health aide, you travel far. I know. I mean, I'm trying to ask you the question. I know the farthest you have driven has been up towards Victor, right outside of Farmington.
Yes.
You know, so, but every day you drive to Phelps, which is 35 minutes, 6 days a week. So the reason why I said that is because it was stated that some people just don't want to work. Well, every day, 6 days a week, Jen's going to, driving 35 minutes, to take care, to do something that she really enjoys. And I think I can say that you absolutely just love what you do.
Yeah. Right.
And
Yeah.
you are also CPR certified.
Hmm?
This is really bad. I'm bombing on the air. I don't know her certifications, ladies and gentlemen. Hey Jen, help me out. Do you have any other certifications?
Probably. We had to be CPR certified at Clifton, but when Rochester Regional took over, you didn't have to be. But yeah, when we were CPR certified, you'd have to check the sheet every morning if you were on the code team, and pray to God you didn't hear that overhead, because I've had to run down to the ER a few times for codes that came in on an ambulance. So never fun.
Yeah,
The first time I did it, my hands were just shaking afterwards. And the activities lady's like, honey, are you okay? I'm like, hands stop shaking. All the adrenaline was just
right.
Yeah.
But along with the CPR, you can do vitals, you can do other stuff like you're familiar with like colostomy bags, Foley's, and all that. Yep.
So like you get an order from like a nurse or a doctor or something like that. They'll put out a notice and say, hey, go here, go there. This person has this problem, or so you like, how do you know where you're going every day? You just like
it's whoever we get contracted through the VA.
Okay.
And through other places, Office of the Aging.
Yep.
And whoever needs the help, they get put into Rochester Regional, and then they see what staff is around what area, and then they send you. So
whoever's the closest.
Yep.
Right.
Mm-hmm.
Okay. Gotcha.
Okay. Yeah.
And a month ago, Jen, you were one of 4 aides that got appointed to senior aide in your, I want to say, district area. Mm-hmm. So what that, I don't know, Jen, you can, if you want, explain what that means.
Just for more not difficult, but more like if someone had a stroke, or more high level of care to take care of. So
right. So then that means you had to be like different certifications for different situations. So if they have,
and if they have like classes like at Rochester, like we can go take them and everything, they'll send us or something like that. But yeah, or if there's new aides, we can train them. I mean, they get trained like 3 or 4 days, and then if they feel secure, then they're put on their own. Yeah.
Right.
Do you remember how many, off the top of your head, how many applicants there were for the senior aide?
About 16, and 3 of us got it. Yeah.
So
okay.
So the reason why I wanted you to say that, so people spend years just bouncing from job to job or whatever, and I think the longevity of 30 years just, I mean, I think it's when she was asked to put her name in, I'm just saying you got 30 years and you probably forgot more about the healthcare field than you'll ever know. And I just think like the longevity obviously comes into play later in life, and it benefits you. So I wanted to tell our listeners, and I said earlier that's how I met Jen. So Jen and I used to work together in Waterloo. So that's going back to 1999. So that's just showing my age. You're all welcome. So what other, George, knock it off. I will figure out how to change your name somehow. Do you have another, I want to say it like this, like a feel good story that you can share?
I have 2 stories that are part of the reason why I do what I do. I'm going to try to say this without divulging too much. When I was at Clifton, they had a job opening for rehab aide, which you do therapy, exercises with people, walk them. So I got that job with another aide, and every other week we'd be a CNA, and then the opposite week she'd be the rehab aide, and then we'd swap. So I started doing rehab with somebody, and then like if I had to float, I'd go over on that floor and I'd see the person, whatever. But they were basically clinically depressed. The poor guy was sad. Well, I'd go in there and we'd just shoot the shit. We'd laugh. I'd tell him about my day, tell him about my dog or my cat. And he goes to me, he goes, you know, you make this very difficult. I go, what do you mean? He's like, I'm very depressed. I feel like, you know, like crying, but you make me laugh so much. He's like, you got me pulled in two different directions. I'm like, well, I'm sorry. So I try to bring laughter. I mean, the people I take care of now, they laugh. We're like an old married couple, me and a few of them, like 6 years, you can't like not be joking with them. But another one, they were on my floor. We were together for a while. I did therapy with them too. I can't say what she had, HIPAA, but they went to the hospital. They weren't doing too good. I went up to the hospital after work to see them, and I just sat there. Their kids weren't there. They left the room. But I just talked to them, and I'm like, if you could see how they have your pillows. So I was rearranging. They had to have her pillows under the, and they wanted their hair done when they got sent down to the ER, and I'm like, no. I go, you have to go. Like, you have to go. And I always thought that they were mad at me. So I sat by their bed at the hospital and I started crying. I'm like, I go, I hope you're not mad. I go, I needed you to get help. I just needed you to get better. And I left, past her family on the way back, but she passed a few days later. And I found out her sister came from Arizona. I knew her sister, and she comes to me. She's like, she loved you so much. She's like, she really cared about you. She's like, when she got the tube out, she's first words were, get Jenn. Get Jenn. And she's like, I had no way to get a hold of you. I did not know how to get a hold of you. I would have been right up there. But I'm like, what was she going to yell at me for not doing it here? But that relationship that you get with these people, I mean, it's something that you don't normally get at a job. You don't get that at the Dollar General. You don't get that other jobs. I'm like, they become family. And even the people I take care of now told me that I feel like you as my family. And I know that it could be frowned upon, but we see them every day, and you have to be cold-hearted to not have a connection with somebody like that.
Yeah. You know, I remember listening to George's wife, Jenn, and Eric's wife, Christina, and Jenn talking about, you know, the care, the comfort. And I personally just think that you don't hear much of that, right? I mean, you know, especially, you know, all of our wives are taking care of people, trying to just say it correctly. But I think not only with my Jenn, but George's Jenn and Eric's wife, Christine, they all put a lot of care, because that's what I tell Jenn all the time. You know, I'm like, you're going into people's houses, you're making them feel like they're a normal person. You don't just treat them like a paycheck. And I think that's just very, I don't know what the word I'm looking for. I mean, if I had a loved one and somebody to take care of them, I would exactly want what all three of our wives do. Treat them like a person and not just, oh, hey, I'm here to collect, you know, a paycheck for an hour or whatever. So
right. Yeah, and that's,
there can be trying ones.
yeah.
There can be trying ones that are not nice. That's why I said
Oh, yeah.
when I got into home care, it was a lot less stressful because it was very stressful at times in the nursing home. Depends on who you work with too. So I was with Anna or other Kelly or my other co-workers that just made work more fun. But if you were with people that you felt like you had to do it all and it just got to you, so
Yeah. I mean, it's
kind of I know I could never have done that profession. I wish I could have, but when I was in the Army, I needed promotion points and I took a combat lifesaver course. I ended up, you could give IVs and there's so much I could do. And fortunately, I only had to use it once ever. But I mean, the guy, because I don't know if I told everybody, but we went to Bosnia, which didn't last long. We weren't there a week, but somebody fell down and cut their leg pretty severely. And because I was trained, I had to go and take care of it. But I'm glad I didn't have to do it more because I know I can't do it. I'm not being selfish. I was doing it for promotion points. I was trying to move up, and that was 200 points just for taking that class. But I actually had to use it once, and I knew after that there's no way I could do that as a profession. Anything in the medical field, I know I could not do it. Especially where you see the same people every day and then have one of them, pass away, or I was like, no, I can't do that. So I definitely respect anybody who does it.
definitely.
I know, George, thank you for that. But just before I say what I want to say, even though you took a class in the Army to you call it selfish. I mean, I don't. I mean, that's just part of life.
No, I don't. I mean, I don't know if it was selfish or not, but
it came back. But what that class that you took, you obviously paid attention because you took that information and you. If that person didn't, if that person didn't need your care, would they have lost their leg or their life?
Maybe. I don't know. I don't know how severe it was. I mean, I know he had a huge cut on his lower leg, and I wrapped it. I cleaned it and then I wrapped it, and then the medics came.
Gotcha.
So
okay,
because the medics, the medics don't go. They're not everywhere. They have their place where they go. Now, a medic will go with, like if you're going out into the woods, like let's say we're in, like back in Vietnam and Korea and all them, a medic would go out with the platoon, but only one medic. But they can't be everywhere. There's only so many of them. So, and there's the little kitty.
I showed Jenn the pictures today.
Yeah.
So I do have one thing I want to say, but I'm going to take a quick commercial break because we're going to go over time limit. So don't go anywhere.
Tell Jeff.
No, I won't. Hey, ladies and gentlemen, we are back. We are doing Jennifer's, my wife Jennifer's 30-year career. I don't know if I want to call it a career. It's your choice to do. It's not like how like me. Okay, so the job I particularly do, I just kind of fell into it and just kind of stayed with it for the last 27 years. But I don't know if I want to call it a career. You just chose to make people happy. And I know that the company that you work for, a few years ago, somebody took over a new higher position, and you had received something in the mail. Now, without going over the HIPAA laws or anything, can you tell our viewers and our listeners, and our two distinguished gentlemen, said that with a straight face, what you received.
It was just a person I took care of. Their daughter wrote to my company, the higher up at the hospital, about, you know, praising me, such good care I took, had a real connection with the father, which in such a short amount of time that I took care of him, she's like, she was very impressed. She said that if I ever needed a reference or whatever, that she would more gladly do it. She's like, I'm an asset to the company. And I got a call one day on my work phone. I didn't know the number, so I answered it, and it was so and so who took over a high up senior position at Rochester Regional, said that he saw the letter and just wanted to talk to the person that it was written for and to say thank you and congratulations and just good job, basically.
So, you know, the reason why I wanted you to talk about that is because obviously we had mentioned several times earlier and in previous shows, you know, the lack of respect and stuff like that. And you know, when you hear higher up or suits or like, you know, you just don't think like they look at people below them. But you know, for I remember the day you were so happy. You're like, I got this number. I didn't even recognize. I didn't even answer it. And I listened to the voicemail, and I'm like, okay, what was it about? I just thought it was really cool that a higher up, I'm trying to say it right, you know, reached out to say, hey, I had received this positive feedback, and I wanted to talk to you directly. You know, I mean, you know, and like Eric and George, you know, you're at your job. I mean, you know, if somebody just walks by and gives you a thumb up, you're like, yeah, okay. But if they pull you aside and they give you a direct like line of communication, it makes you feel pretty good, right?
Yeah, definitely.
Yeah, and again, you know, I mean, I'm kind of partial, obviously, but I just remember that day. You were just your smile was so big. I thought it was because I came through the door, but it wasn't. But no, but you know, we talk about not being appreciated or respected in what you do for a living, and I just thought that was a perfect, you know, just for what you do and how much you care about your job. And I think that's the biggest thing that I respect about you for what you do is you absolutely just love what you do. And
that's what it sure sounds like. Definitely.
Yeah.
I had a few other guys write in. They'd write to my supervisor. I like Jenn. She's good. Just like the little.
Good's always better than bad.
Yep.
So 1999, or I'm sorry, when was your junior year?
95.
95. So, what is one thing? I don't know if you can or if you want to. What is one thing that you don't like about this profession?
When I was in the nursing home, it was short staff. I mean, I liked the nurses I worked with. I liked my managers. They were fine with me. I mean, just staffing. And now I'm basically on my own. I see my supervisor every so often at someone's house, but that's about it. Basically, it's just the staffing issues, which has been like that forever. So,
Okay, so my other question, and I'm going to put you right on the spot. If you could get out of the role of, you know, your home health aide and jump up to a supervisorial role, what would you? I know you can't answer directly, but what if you were in a supervisory or managerial position? How would you? I'm trying to think of how to say it so I don't cross any lines. How would you make sure everything? What would you do differently? I guess it's the easiest way I can say it. I don't know how to ask that question without crossing lines. Like you're a supervisor. You're supervisor, Jenn, and you have 4 people working underneath you.
I have no idea.
Oh,
Be more involved. I mean, I don't know, because they always was said that the aide is the first line of defense in the nursing home, because we knew what looked funny, what felt funny, what was wrong. Hey, I think they're having this. That doesn't look right. Because we were there every day. And I mean, I tell my supervisor now of something, we're very vocal, keeping them up to date and everything. But I would get nursing more involved in some of the things, because I see that nursing isn't involved in some things, but I don't know, or therapy. I think everyone needs therapy, like walking, occupational, just any, I mean, psychologists, something, they need some form of something, Yeah, they walk great. Well, could they do this differently? Or I don't know. But
so
there's the insurance, there's this you got to deal with. So that's what is crappy too. So
like your upper management positions. So like, do they like delegate? Are they like involved as supervisors to like assist you when they're short help, or
it's
what-
said that if we used to have, they called must fill cases. They were the people that had like the ceiling lifts or the whatever, they were the must fill. And if they didn't have
they did?
aides, it was said that I think therapy or nursing was to go there and do it. But we don't have the must fills anymore. And I know in Yates County, but they might have them some other place. But yeah, they're supposed to. I mean, that's why I don't like to take time off, because I'm like, who's going to see my people? I feel guilty.
Right.
So, well, we don't have an aide to see them. I'm like, well,
Yeah. So it sounds like you have to multitask a lot outside of what your normal trade is. You have to kind of
I
if needed, and then there's
very vocal with my supervisor. I let her know this and that, or my scheduler, and
which
just
I'm sure it makes it more stressful on upper management when they are short help, short staff, because they gotta, unfortunately overwork other people that are there.
Oh yeah, my supervisor was the only supervisor for a while in like three counties. So she had a lot until they hired another RN. So yeah, she was very busy for a while.
3 counties?
I think
Oh,
4,
wow.
because we do Auburn too.
Wow. Wow, I didn't think that. I was thinking like maybe 1 or 2, maybe.
No, Yates, Ontario, Seneca, and
That's
Auburn, Hugo, yeah. All the way up to Rochester.
wow,
Yep.
huge.
Yeah, I mean, and so just through Jen's employer, she's the only home health aide here in Yates County that, unless there's somebody else, but we doubt it. But so,
Yeah.
I'm glad that you brought up the insurance, and I know that we could do 18 hours of insurance, but this is just my opinion. I think it's horrible that insurance only allows X amount, and I just think like that there's these people that need help, they need care, and I'm gonna cross a line here, and I probably get shut down, but a few years ago, wasn't there safe spaces so people can shoot up, right? Or I'm not going to go into a big deal, right? There was something like that. So that's okay, but there are people that served our country, men and women that served our country, have worked all their lives. They are in need of help, but their insurance is going to say, "Oh, you're only allowed this much help." I think that's absolutely bullshit. I mean, all of your wife, or yeah, sorry, not Jen's wife, but Jenn and
My wife.
Christine, and the hundreds and thousands of people that do this, there's just and people are just sitting at home because their insurance denies them. I disagree with that. I think it's bullshit.
Right.
That's why when I was a rehab aide in the nursing home, because if you fall or whatever, occupational and physical therapy only took care of you for this long, because that's the insurance. So if they needed extra help, therapy would sign them over to us. So we'd do their exercises, we'd walk them. So we would continue it. We could do it. It wasn't billed, it wasn't billed under their insurance or whatever, but it was something that we could do, that we were able to do. So at least that was one good thing. But
Yeah.
some places it's like 3 months. Okay, you're done. You have to fall again for us to pick you back up for another 3 months. So
Right. I mean, a lot of it, I mean, without getting into too details, I know a little bit about some of this stuff, but like I said, you don't want to say too much and get canceled. So, I mean, a lot of it's like the Medicaid stuff depends on your age, and then what's wrong with you, and then what kind of insurance you got. So if you're at a certain age, no matter what you have wrong with you at 65, say, your insurance is only covering 20%, and the rest the government picks up. So then there's a big problem, with, you got people paying for insurance to have, and the insurance company's only paying 20% because that's all they have to pay.
Yeah.
Why can't they pick up more money? I mean, why don't they negotiate a better deal with the government? Because they don't want to, because there's other reasons that I don't want to get into here, but right. They're going to hurt the shareholders. And when you're making profit off of healthcare, they don't like anybody coming in and changing that. And that's a big problem with it, which you're right, Jeff. I mean, there's a lot of people out there that suffer. And unfortunately, I mean, not being pro-government, but if the government didn't step in and do something, they don't do a lot because their hands are tied by lobbyists, and they don't want to, I mean, they could do more, but I think it works both ways. I mean?
Yeah, no, I agree.
Government's tied by private industry, and it's sad. I mean, it comes down to money instead of people's health.
Yeah.
It's terrible, I mean, but everybody under the sun and all these organizations and what have you will raise money other ways, but then they don't do it the way you should do it. That's what I don't understand as a citizen of this country. I mean, you can put billions of dollars, trillions of dollars into these organizations that make, they're making a lot of money off it, and who suffers? The people that say they're going to get the money, but how much corporate upper management ownership stockholders are making the money, and the 10% goes to the starving veteran that's on the side of the street,
Agreed.
That's struggling to stay alive. So becomes an alcoholic, a druggie, and then he ends up in these government funded places, in a city, in a town, wherever. Yeah, it's terrible that we have to have that, but just think if we didn't have some of that, where are these people? Yeah. I mean, you'd see them down the road. I mean, it's sad, but that's my thinking of it, and it's without getting into a lot of politics.
Yep. I agree.
Terrible. I mean, it could be so much better. I mean, this is, we shouldn't be talking about it, in my opinion.
George, anything?
No. No, definitely agree with what he was saying. That the people that need the help, it's not there for them. Yeah. Usually, I mean,
Yeah. I mean, I wanted to go a little bit farther, but I wanted to see if anybody had a little more onto it. But in my 30 years of being a mechanic, all right, 20 years of it was being a transit bus mechanic. In 15 years of being a transit bus mechanic, I was a paratransit mechanic. I was responsible by myself pretty much for 28 vehicles for paratransit, which helps all kinds of different people, from low to middle class to wealthy people. That is government funded. It's a non-for-profit transportation service for Tompkins County. And through those years, I seen a lot of people that were sick, and there are things that I did on those, to keep that vehicles going, to get people a ride. Some of it was free. It was, it was Medicaid funded. Some of it was paid by donors. Some, people that wanted to just pay to ride the bus, to go to all kinds of different things, wheelchairs and walkers. And so I had to deal with that kind of stuff, going on road calls when buses break down, and try to get people that are in very bad condition, and I just did it. That was as close as I got to the medical field. I wasn't assisted, but I was a mechanic, and I had to see things that a lot of mechanics wouldn't want to experience. And that's why a lot of people didn't like working on those vehicles, because it's that's part of the job. You know, you can't stop and say, well, I'm not doing it. You have to go,
Right.
you know,
Yeah.
and it's sad. I mean, I've seen a lot of kids from youngsters all the way up to people that were 90 years old in all different conditions, and you're having to work on something that it's not, you know, and I've seen that through my whole career, and I'm like, I could never do this besides this. I mean, I give these people that take care of people that are in those conditions all kinds of credit. They don't make enough money, you know, they don't get enough recognition for sure. You know, I just see you know, when they take them to the doctor, hospitals, whatever, cancer treatments, and, you know, once it goes through the door of the hospital, you know, I could only imagine, you know, but you see, you know, you get attached to some of the pastors, you see them often, or they'll,
Yeah.
you know, write special notes to the company, and they'll say, hey, your mechanic, you know, thanks him for what he does, and thank yous, and they give me food and through the holidays, and, you know, because basically thanking me for what I do and keeping their vehicle safe, and so they can get to their appointments and shopping and things like that, you know.
Yep. You get close to the families. Yep.
Yeah. I mean, they would come by the shop. They would have the bus driver come by the shop, and these people would come in and say, hi, how you doing?
Hi.
Thanks for you. Have a nice Christmas, whatever, you know, and that's, so I did
Awesome.
for a long time. And, you know, then I left, I retired from it and moved on, and they were sad to see me go. Trying to get me back for a long time. Anyway, now I'm on,
so
but I just wanted to put there, you know.
no, absolutely. No, you're absolutely right. I mean, I know that you had said that this is the closest you got to the medical field, but you going out and working on a bus or transit that broke down, that's just as important. So, you know, I mean, without that, they wouldn't have been able to go to their appointments or wherever they want. So, you know, so kudos to you as well. So, yeah.
Right. I mean, one year we actually, one out of the years I worked there, we won it's called the APTA award. It's the best transit system in the United States. We won that award in 2011.
Nice. Congratulations.
That fleet we worked on, we hauled 4.3 million people.
Wow. Wow. So,
tells you how busy it is in Tompkins County.
Yeah. So George, just before I ask her one final question, do you have anything that you want to ask her or add, or?
No, I have nothing.
Okay. So obviously, Jen, in 30 years, you've had many ups and downs in the healthcare field. I'm sure you could sit here for the next 24 hours and tell all the highs and the lows. Now, think of all the lows that you've had in your 30 years. My final question to you is, if you were given the chance, would you do it all over again?
Yeah. Because I couldn't be a vet tech.
So for all of our viewers and listeners, I don't know if Eric and George know this, but Jen is a very, very avid animal lover. That's why she wants to adopt every single animal from every shelter around her. Every time we're out and about, she sees a cat over in the field. Oh, slow down! I'm like, no. But so,
well, she's not the only one. I mean, you just saw the cat that Eric was holding earlier.
Right.
Yep.
That used to live outside.
Looking at the Humane Society website before the show, so I don't want to hear it.
that cat that he was holding used to live outside on my porch.
Yep.
Oh.
And he looks so cute.
Yep. She definitely is.
Yep.
Growing every day.
No, I like seeing the pictures, and just so you guys, so when we went and got Bobby Sue 7-8 months ago, whatever it was, I can't remember. There was this cat, and not to get off Jen's story, but there was this cat all alone, right? And it said, been here 200 days or whatever. I can't remember what it was. And it said, we asked about it. It was like, oh, it has leukemia. And we're like, oh, no, we don't want to take a cat that has leukemia. But now they're saying that the cat can be around other stuff. And so, right, Jen, or am I miss?
Well, when we went, they said that the cat's got leukemia. It has to be an only cat. I'm like, well, I applied to look at cats. I said we wanted 2, but we were never told that. So they just put it on the website older cats, adoption fees waived, and this cat was still there. So I wrote a comment. I go, it sucks that the cat has to be an only cat. And they're like, well, it doesn't if the other cat that you have at home is got the vaccination for leukemia. So I'm like, well, wait a minute. Why didn't you just tell us that in October when we were there? So I wrote him back and said, what about the saliva? What about the drinking, the food dish? Do they have to be separate? Like, get your story straight.
Right.
So long story short, we're probably going back not this Saturday, but the following Saturday to get that cat Ginger. So yeah.
If Bobby Sue can be vaccinated and if it's safe, because looking at that poor cat, I'm like, no animal should be in a shelter for almost a year.
Yeah.
But so Eric or George, go ahead.
Yeah, I mean, while we're talking on the animal subject, so like when you've done your career of what you've done for 30 years, have you ever had an animal issue with people that like that you've had to experience? You know, with people that you've had to do. I don't know. Do they get like you get close to their pets that they have? Like, are there other things besides the person you're caring for? Do you get like you come in the house where you're going, you know, and the dog comes up to you, cat or
it's
something?
more than the house because every animal loves me. They're like, oh my God, they don't like anybody except you or this and that. And then when they're discharged, I'm like, I'm more sad about not seeing the animal.
Right.
I'm like, oh, I wonder how Bob's doing.
I think
she's only kidding our listeners. She really does not mean that.
No, I miss them too, but I wonder about the animal. Like I drive by someone's house and I'm like, I'm looking for the dog. I'm like, did it pass away? Is it still there?
Now I think I figured out why she's an animal lover. There's your answer.
Oh, I'm sorry. I saw George's eyes light up, and I thought the joke was coming towards me, so I just pointed to myself. So,
well, I was, when she said, about the shelter and whatnot, I was thinking, is that really where they met, or did they meet at a shelter? Like he had a sign on the side of his cage,
Right.
And I was covered in feces, right?
Probably. Has to be an only human.
Yeah.
Can't be around others.
Right. Man, that makes
it was only a matter of time. But so what we obviously every time somebody we do a story and somebody tells a story. So Jenn, I'm gonna let you just give your one last final thought on the whole healthcare and just from your perspective, because it's been very well established that you absolutely just love what you do, and I can say this, and not because I know you, but they could pay you double what you're making, and you're still going to continue to go above and beyond because that's what you've been doing for 30 years. So you are just one of the rare people that love what they do. You hear me complain about my job 100 times a day. I just know how much you love what you do. I just want end the show with your take on the health field and all that, and maybe you might inspire somebody down the road to really take their job serious or to get into the healthcare profession.
I don't know. I mean, I know healthcare is not for everybody, but if you want to make a difference, you like taking care of people, or you want to see change, I say go into the healthcare. Just try it out. Talk to people that are in it. I know it's challenging, and I know a lot of people have gotten out of healthcare, which hurts them because they're upset that they had to leave, but I know it does get to you. But if you find the right place to work and everything and the right people, that it's worth it. So give it a shot and it could change your life. I know I don't make millions of dollars, but sometimes it's not about the money, but it is about the money. But it's it's about more than that. It's about making a difference in someone's lives, that you're the only family that sometimes they have. Like when they're on their deathbed, no one's around, but you want to be there right beside them. And it changes you when they take their last breath, and you're the only one there. I mean, it makes a difference to them. And that's the side that people don't see. They only see the bad, like you didn't change mom every 20 minutes, or you didn't answer the bell. And no, but we were with your mother when she needed someone the most. So, that's it.
Yeah.
No, I think that was perfectly said. And just before I end the show, like I don't know, I was listening to what you were saying, and you're right. People will tell you, oh, hey, you weren't there for Mrs. Smith when she needed, her bed sheets or whatever. But what they don't understand is, not only you and Eric and George's wife and millions of other healthcare, you were there.
We try our best, and
you're there, like you said. You may be the only family to them at that particular moment, and not to get too sappy on the show, but if it's their last breath and you're the one there, that's what they don't see or understand. And to be honest, I did do the profession for a while, but I don't think I don't think I was any good at it. And I would not be able to do it now, anyways.
What was it? I mean, why do you think the reason that you didn't want to do it anymore? What was the tough
the
part?
jeans got too tight.
Was it like, I mean, was it you just weren't cut out for it? But I mean, is that about what it is? You just didn't.
The white pants were too tight. Shut up, George. No,
I know he's gonna say that.
Yeah. Honestly, well, one, I took the job because I needed a job, and I found the classes quite easy, but I don't know. I think when you're this is going back 30 years or more. I just think like when you're taking care of somebody, you should be able to spend time. I mean, I don't even have anywhere near the experience that Jenn has or your guys' wives, and I'm not gonna pretend that I do, but I just thought like there's just for simple math, there's 10 people, but there's 2 people to take care of all these 10. That's get them up, shower, groom, activities, feed. You just can't do it, and I just felt like it was too much for me to watch somebody not get what they need. And what are you supposed to do? I'm going to try to just like not say how I want to say it, but like if Mr. Smith really needs to get up because he's got to go to a doctor's appointment, but you got somebody else who needs more care, like you got it. To me, I had to take away time for this one to do this one, and I mean Jenn could tell you your wife could more than I could. It's just
so you kind of struggle with the multitasking part of it.
Well, no, it wasn't. No, because that part was easy. It was just the whole too many people, and you couldn't give them the proper in the nursing home or the hospital or whatever. You couldn't. To me, you couldn't give them the proper care that they deserve.
Oh, okay.
Especially like so, like when meals, if there's 20 people and 10 of them need to be fed, and there's only 2 or 3 people, you kind of. So yeah, Jenn, go ahead.
I remember we used to have nurse or CNA students come in, and then the nursing instructor, we got to know them pretty good, and they'd give them someone off of each assignment or whatever. So I had the nursing instructor with me, and they had one of my people, and they're watching them, and I'm shooting the shit with the nursing instructor, and we're laughing. That we're like, breakfast is here. They're trying, they're watching, and I'm like, the nursing instructor's like, well, you did that in 40 minutes. Like joking with him. I go, yeah. I go, Mrs. Smith has been ringing for 20. I go, we got head on the floor in there. We got a code down, and they're all looking at me like, what? And the nursing instructor like, this is real life. That's real life. That's how, like, it's just, and you gotta, and it stinks, but it was just so funny. They're like, what? I'm like, yeah, come on. And breakfast is here. We got to take Mrs. Smith to an appointment. They're like, ah.
So to answer your question a little bit farther, Eric, and if this show crosses any lines, I'll take full responsibility. So, and I'm sure that Jen will understand, and both your wives.
Yeah.
And I'll make it quick. So
Yeah.
every year, as we know, the state would come in, right? The higher ups had to come and make sure that whatever facility was up to par. And it just seemed like we were always fully staffed. All the nurses were
At the time they were coming in.
Yep.
they were pitching in more.
Right.
And it just was like, you know,
More- like
and that was the only time that you saw fully staffed and nurses helping out and this and that. And but the moment that, you know, the state was in, you know, it's kind of like, you know, George, yeah, like at your guys' job, you know, you have people come in and everything just works out perfectly, right? But that's one day, you're thinking to yourself, well, okay, what about the other, you know, 94 days when everything was shit?
Perfect. Yeah, because when we have to do 2 inspections a year because we do food service products. And you know right before it's coming up because everybody's out on the floor cleaning and it's like, yeah, well, you know, this place isn't that clean a week ago.
Right.
No, right, and I agree with you.
And I'm not saying by any means where it's a dirty warehouse, but it's a brick wall, cement floor warehouse.
Yep.
I mean, you know, you can only, I mean, you wash it, you run the sweeper over it today, it's going to be dusty tomorrow.
Yep. And I'm not saying that all the nurses felt like it wasn't their job, because there was some nurses that would really help out, and I can't remember their names. I'll talk to Jen off the air because she knows all the names. But like, so after the state left, it went back to, well, not my job, and I'm like, you know, so yeah, that was another thing that I struggled with, and so yeah, so that was
I just thought being you two married and doing the same kind of trade, you know, when you were doing it, you think that maybe it would. I didn't know if that was a conflict, like, you know, when you got two people doing the same job that live together, is that, you know, does that get stressful? Does it get, I mean, or is that person helpful? Or is like, if they're trying to tell you something that you're struggling with and you don't like, you know, the answer, or is it just too much? It's like it never went away kind of thing.
Oh, when I was in the health field?
Yeah, like when you were in the health, it just felt like it was always constantly, like you don't get a break. I mean, what Jen's been saying, it's like you're always something, you know, it like doesn't go away. I mean, you're there when you're working 8 hours, you're like, you know, because most jobs you go and work 8 hours and you're not working 8 hours.
Right.
You have lunch breaks, you have time in between doing something, you know, you have those moments where you're not always working. But in that industry, you're always working. I mean,
my head would always go, all right, are we fully staffed? What assignment do I have? Who should I get up first? Okay, this one can wait for a shower until after breakfast. And I can get, like, my mind would not stop. In the morning, I'd be like, all right, I'll do this one first and that one and that. Like I was 3 steps ahead so I could get stuff done.
Yeah, right. And that's where a lot of people, I mean, it's probably why they are hurting for staffing a lot, because it's hard to get somebody besides not wanting to come to work, you know, that kind of, but it's a lot for people to take in, you know, people can only do one thing all day long. You know what I mean? If they have to do 3 things and then the 4th thing's like, I forget it, I quit.
Yeah.
I mean, if that goes on all the time, it seems like somebody in the system that's ahead of the system would try to like fix that, you know what I mean, where it makes it a little more, you know what I mean, you kind of break it down into kind of like a sub-council or a skilled trade kind of thing where, hey, you're doing this, you're doing that, you're doing this. So you're not bringing so many people out, you know, that you do have to do the work. It seems like that's like what we've been talking about for a little bit, you know, just makes it tough.
You know, and one of the things Jen said, you know, she said floating. That means where you go to another floor. And if you were lucky and you got somebody who knew how to do their job and they came to your floor, that was great. Or if you got somebody who didn't know what to do, or if you had to go to a floor and you didn't know the people,
right?
You know, like Jen said, you know, that the trainee took 40 minutes, whatever. You don't honestly have that much time, so
Right.
Yeah, so that was a struggle too.
Mhm.
Yeah, because if it's just you on the floor and they send somebody over, they're not going to blame the new person. That they're like, oh, they didn't know, and you've been here forever. And it's like, but
Right.
yeah,
That's
but
tough.
it is what it is. So
Yeah, right. Whatever. Everything happens for a reason,
yeah,
If
but
it ain't meant to be, it ain't meant to be, you have to try
yep.
something different,
But Jenn, I want to thank you. I know that we had talked months ago about you wanting to talk about your health career. I know there was a lot of things that some viewers or listeners would be like, what? I don't understand that. Just so our viewers, we can't say certain things because of HIPAA laws, and we're not out to get anybody in trouble or cost anybody their jobs or anything. And just to clarify, not my wife, not George's wife, not Eric's wife takes care of anybody named Mr. or Mrs. Smith. That was just the quickest name I came up with. So don't think so don't think that anybody that were yeah, Bob.
Oh, come on,
But
Bob. Come on, we got to take care of Mrs. Smith. She does all the pies for the holidays.
Bob Smith.
He's just Mrs. Smith pies. But no, Jenn, thank you. I think that you might obviously inspire somebody to like their job more if they're, especially if in any type of a healthcare or where they're in the profession of helping somebody. It could be a life coach or anything. And obviously your 30-year just speaks of longevity. And I think what separates you, I've said it before, is you absolutely just love what you do. I know you have bad days like everybody else, but you absolutely love what you do. And obviously, if you had to rewind the button 30 plus years, you'd do it all over again. So, would you
meet
still
you
wear,
all over.
would you still wear the white pants? Okay. With that, ladies and gentlemen, thank you for sticking with us. And if you're in the health field, leave us a comment. Let us know what you think, what you do. Let us know if you're an aide, a home health aide, a nurse, or if you're a candy striper or whatever. Let us know. And if you're Mrs. Smith, hey, you're welcome. For that, I have been your host, JDUBBS. With me, as always, are my excellent guests, Eric Evans, George Muzzy, and our special guest tonight, my wife, Jenn, talking about her 30-year health career. With that, I am going to let George laugh at me when I try to find the stop record button. Like, comment, subscribe, and we're all over the place, and we're popular in Hong Kong. We'll be heading there soon. Not really, but thank you. Enjoy. Eh, eh, eh. So here's a quick question. I'm just only going to record for a couple minutes. I want to ask you each a question, okay? And I want you to think about it. We're okay. Rewind the clock. We're all back in college, right? None of us went to college, but anyway, maybe Jenn did. I did for a while. I knew it. Yeah. Okay. Right. Okay. Let's go back to 1994, 95, right? I know, George, you're in the Army, but let's just say we're all on our way to college, right?
I was still in high school.
Shut up. We all get offered a annual contract of $50,000. Are you going to say yes or going to say no? Go back 30 years. You're in college. I don't know what the price of college, but let's just say for basic math, the average college that we wanted to attend was $30,000. But now there's this NIL deal, right? And they're going to offer you $50,000.
Mhm.
What are you going to do?
Right now.
Yeah.
Well, I mean, I think I would take it in one way, and other ways I wouldn't take it.
No,
because the part you ask, the part you
years. You got to go back 30 years.
Right. Oh, right. 50,000 30 years ago was like probably 200,000.
Yeah.
Oh, yeah.
With the inflation.
I mean, I would have jumped all over $50,000 30 years ago. I mean, I probably would have been dead on alcohol and drugs, but that was just different time. But I'm just saying, like, so and on our next show, we're going to talk about the negatives of sports, and I'm just thinking, like, because Eric, he just said, a walk-on who made all this money. You're right. They say, well, we're not going to pay you all that money, but then that kid can just say, well, I'll just go back to college if he didn't graduate, and NIL deal is going to be there. So, like, I don't know.
Because a lot of these NIL deals, the part they don't talk about, and they keep it silent, is that they don't talk about after they get out of college. So like if they have an NIL deal for $5 million, is that only when they're in college, or does that extend out 5 years?
That's a good question.
You know what I'm saying? You don't know that. They don't talk about that. So if these guys are they double dipping when they get in the NFL? So they're signing a huge contract, and then they're also making their NIL money that maybe was extended out.
Yeah, and here's the thought. Let's take the number 1 overall pick for the WNBA in the NFL, right? Or in the NBA, right?
Yeah.
For basic math, let's say their NIL deal is $100,000, right?
Yep.
The number 1 pick is guaranteed millions, and
Right.
what comes with endorsements, right?
Mm-hmm.
I mean, I don't know how much a shoe endorsement or a Subway commercial. I mean,
That's what
world, come support our podcast and endorse us, and I can give you a better idea. But think about it: if they're already making $100,000 for 4 years, and they're going to go into be the number 1 in the top 5, you're guaranteed minimum of signing around a $30 million contract. And nowadays, most of that is a signing bonus that is guaranteed.
Right.
So you're a walk-on. You're the number 2 overall pick for the Washington Redskins. They just gave you a 4-year deal with a fifth year player option at $39, and 31 of it's guaranteed.
Sure.
I mean, it's like,
Uh-huh.
it's horrible.
Right. And then with the NIL deals, they sign a $5 million contract, right? So then all these colleges are saying, well, we're going to pull the money for your academic guarantee, right? So what? Let them pull it. And that's what the big argument is with the kids, is they can go ahead and pull the money, because the sponsorship that's paying me $5 million a year is paying the stadium another $50 million a year to sponsor the stadium. So they're going to say, okay, we're paying you $50 million for advertising, which pays for academic finances for kids that are guaranteed. Who's paying that? You think the university is paying the academics, to give them a free ride, to give them a scholarship? Who's paying for that? Corporate America.
Yep.
These donors. So all that, and that's what the kids, and they're smart by doing what they're doing, because they're cracking that egg. They're getting into that money. That's a big bunch of bullcrap, in my opinion. That they're making a ton of money. These colleges are, and they're all sitting up in the sweet boxes and loving it. And these kids are beating their bodies up for nothing.
So
they're holding that carrot over them, saying, "Oh, well, we're going to pull your academic money." Well, why? They're employees of the college, no matter how they look at it, and that's why that was settled. When the NIL deal was settled, because they're considered employees.
Do you want to know what to me, my opinion, what set this whole entire NIL deal into motion?
Yeah.
And we'll talk about so all of our listeners, this is just a prelude. Go back, I think it's 19. Oh God, I have to look it up. There was 2 brothers. They were the O'Bannon brothers. They played for UCLA, and of course, every college team sells jerseys, right? They were wondering how come they weren't getting money. That's why I think for a couple of years, NCAA didn't have a sport game out for like the PS3 or whatever.
Yep.
So
the
brothers, 20 some years ago or whatever it was, set this into motion. So I'm going to hit stop real quick.